So motion sickness is the feeling of dizziness, nausea, and sometimes vomiting, especially when we are traveling in a car, boat, plane, or sometimes when we are riding in an amusement park. So it happens because there is a disconnect between what your eye see and what your inner ear or brain transmits the sensations. So the common symptoms of motion sickness include nausea, vomiting, dizziness, headache, fatigue, and sometimes few patients those who are very much anxious and have history of frequent motion sickness became pale, like they are very sick, or they give a very sick looking appearance. So several mode of transportation or activity can trigger the motion sickness, especially those which involve the movement or various level of motions, like when we are traveling in a car, especially when a person try to read or focus on the mobile during while traveling in the car, it can give a sensation mismatch. So cars, boat, ship, aeroplane, amusement park rides, trains and subways, sometimes virtual reality, and sometimes when we are pillion on a motorcycle or a bicycle can also trigger the motion sickness. Sometimes elevators, as plus few people are too anxious or have claustrophobia, so they can develop motion sickness in elevator as well. There are several strategies with which an individual can prevent or minimize the motion sickness when traveling or engaging in activity that trigger it. Right. So prevention is actually indicated like we have some behavioral changes basically. First is some preventive measures like choosing the right seat in the car. So the person who is having recurrent episodes of motion sickness are advised to sit in the front seat. So always avoid reading or using mobile phones while traveling. On a boat, when they are advised to stay on the deck and focus on the horizon. So what is horizon? Horizon is a line at which it's an imaginary line at which the sky meets the land. So we are always advised to focus on that imaginary line while traveling on a boat. Okay. In an aeroplane, when we are traveling in an aeroplane, always advised to sit on the wing seat because the motion is least at that position, and avoid strong smell prior to traveling. So it is always advisable not to use very strong odors of perfumes, food, which can worsen the symptoms of motion sickness. It is always advisable to take breaks while on the long trips. Like, is it advisable to stop frequently or on a long stretch or get some fresh air while traveling? There are some medication also which are used 15 to 20 minutes prior to travel. There are few candies which are ginger supplements. Ginger is a very good anti-nausea properties. And other point is behavioral strategies. So one has to change the behavior while traveling. So they are advised to focus on a horizon point, as we already discussed, or they are advised to focus on a fixed point. Like when they are sitting on a in the front seat, they have to focus on the road, right? So and they have to avoid reading and looking at a screen. Other thing is they are advised to do the breathing and relaxation exercises like slow, deep breathing can calm their body and nausea. And there are few acupressure and acupuncture therapy as well available in the market to reduce the nausea and vomiting during the travel. Next point is the diet and hydration. It is always advised to keep yourself hydrated when you are going on a long trip. Okay, so avoid heavy meals because heavy meals can precipitate nausea, vomiting, and the symptom got worse when you take heavy meals. Okay, there are some cognitive behavioral therapy as well as available in the market as well. So we can go with the cognitive behavior therapy for the same. So frequent motion sickness can have some long-term consequences and complication. So there are potential issues which we'll discuss right now. So there are some development of avoidance behavior. So people who frequently experience motion sickness may start avoiding certain activities and environments like driving in a car, boat, and amusement park. So this can lead to a sedentary lifestyle, social isolation, and a reduction of overall enjoyment of the travel and recreational activities. So avoidance behavior can develop and worsen as well. So another one is anxiety and stress. As we already discussed, an anxious patient can anticipate motion sickness and can and this feeling, this fear of feeling may trigger the symptoms and can worsen it. And there are disrupted daily activities. So in severe cases, when a person is having motion sickness everywhere the person is going. So persistent motion sickness can interfere with their daily activities like commuting, working, or attending some social events, especially if it's not well managed. Well managed means it is there are lots of people, or the patient has to go in the lift, or the patient has to travel in a bus with other colleagues and all. And there are some long-term medication side effects also. If a person is having motion sickness from long, so the person is taking the medications for so long, so these medication can precipitate some side effects. There are some long-term side effects of these medications, like they can have drowsiness, dry mouth, some cognitive impacts are there. Okay, and there are chronic dizziness also. So there is a condition called as vestibular migraine or chronic dizziness, which can be precipitated because of prolonged motion sickness.